Hello and welcome to this month's Health Focus. Southeastern District Health Department, in partnership with Channel 12, puts on these monthly shows to help the public understand a little bit about what the health department has to offer. This month we're going to be talking about breastfeeding and the Women, Infants, Children program that the health department offers. I'm Mary Howell, and today with us we have Cindi Rausch, Hayden-Chavez, and Amy Wood, and we're going to be talking, as I said, about the Women, Infants, Children program the health department has, as well as to address breastfeeding and what the benefits are and some of the tactics that people use to help breastfeed. Cindi, can you give us a little overview about the Women, Infants, Children's program?
Yes, we serve women that are pregnant, breastfeeding, postpartum, infants 0 to 12 months, and children ages 1 to 5. We provide nutrition education services, referrals to other places in the community for help, and we provide WIC vouchers for food, certain food items that they can get at the store.
Now, the other day we had there was an interview done a little bit on the Women, Infants, Children program, which we'll refer to as WIC here in the future. And there was a class going on that they had the parents and the child in teaching them nutritional values, showing them how to cook better for kids. That's a part of it as well, isn't it?
Yes, that's part of the education. We do classes. We also do individual education.
Okay. So if I'm a new mother and this is my first baby, how do you get started with it? Tina or Amy?
I feel like learning as much as you can prenatally about breastfeeding and how to get off to a good start is the best way to approach that. So reading, going to the WIC breastfeeding classes, and educating yourself prenatally first.
Okay, and I know there's a lot of women that are a little confused as to the difference in the nutritional value. Mm-hmm. Can you talk about that a little bit?
There's certainly no comparison to infant formula and human milk, breast milk. Human milk is a superior food.
Okay, I know when I was nursing, they didn't like buddies at all. So really what we eat has an influence over as to what the children are going to be nursing.
What we're really finding is that it's often just all things in moderation. You really don't have to have a special diet or limit things, but there are certain food triggers, and probably Buddy's salad.
Didn't quite.
But generally speaking, what you can eat during pregnancy, you can eat and lactate and nurse without any problems with your baby.
Okay, now if I'm going to be going back to work, because I know there's a lot of mothers that say, well, I'd really like to nurse for 6 months, but realistically, a lot of people are having to go back to work after 6 weeks. How do they choose a breast pump? And then what are some of where can they find them? Online or locally?
When we are helping moms prepare to go back to work, we provide Medellas, right? Medella pumps.
Yes, at WIC.
At WIC. And so really, if you're looking at pumping more than 20 to 30 hours a week, we would recommend kind of a high grade type pump, because you're going to be able to pump the quantity that you need during that time that you're away from your baby, and that's going to be very important for your long-term success at nursing a baby.
Maintaining milk supply.
And maintaining milk supply.
So do we offer that at no charge, or is there a rental fee for the people just in case? There's not.
There's no charge, and they're for women that are working full-time and exclusively breastfeeding. They can't be using formula too.
Storage, freezing. What's the length of time you can freeze the milk?
Freezing the milk, it can last at least 6 months in a deep freeze if it's frozen solid.
Okay. And then recommending to thaw it once you're going to use it, not in a microwave, obviously, right?
Just in tap water.
Tap water. Okay. So for teenagers, do you see there's a difference between teenagers and adults when they're nursing?
Working with teens, I think you just need to give them some extra support, that they may not have the support systems that they need and the education that they need to be successful long term. And so it's really just a matter of giving them as much support and information and props for the work that they do, because it may be a little bit more of a struggle for them over the long run than it may be for someone else. Their bodies physically have the capacity to nurse and to nurse well these little babies. So,
well, I find, having worked with a lot of teenage moms too, that most of them are living at home and sharing residence with their parents, and it's typically one of the only things that they can do personally for their babies. So,
do we go into the school system to? I know that a lot of schools are set up now with daycare for the teenage mothers. Do we go in and actually address them, or do we just let them come to us?
Yes, we have a satellite clinic at the New Horizons school, so we go in there once a month and help them.
And they can get all this information when they start on the WIC program.
Yes.
And that's good to know, because I'm sure there's a lot of people that don't realize that we can go out and help educate the people, or the young women, or even those in their 20s, 30s, and whatnot.
Well, and for those people involved in the WIC program, as a part of their service on WIC, there's a team of lactation people that help with educating, initiating, and keeping breastfeeding going well. So we're on call to do that.
And you'll go to their homes if they call? Do you really? That's awesome.
To the hospital, to their homes, and offer hands-on support.
You had mentioned, Cindi, that it's exclusive. It has to be breastfeeding exclusively. What do you consider a binky? Is that something? There's a lot of people. I know that there was a big discussion when I was having kids, and I didn't want them to have the binky because I was afraid that they wouldn't come back.
You know, I always tell moms, and I don't know, I've probably said this thousands of times, no binkies or bottles until breastfeeding's well established. Because what we do find is if you do early initiation of a binky or a bottle, that can cause baby not to nurse well, for some nipple confusion where baby maybe isn't latching well, and so that will cause breakdown and pain for the mom. And so when we say that, we're trying to help moms kind of prevent some of those things that can happen when we introduce those outside things to the breastfeeding process.
Well, what about, so you've got your established breastfeeding, say 5 months old, and you're going back to work, so some people can't get away to go and nurse at the facility, so they've got the bottle. All of a sudden, they take it for about a month, and they quit the bottle.
And don't want to nurse?
No, they would rather nurse solely and no bottle.
They're smart.
Yeah, I was going to say, I think both my sons did that.
Lots of ways to transition. I mean, if it's a necessity that the baby get the bottle, just being patient with the baby, and it's a learned behavior, and teaching them that, that you can get them to take the bottle if it's necessary. But we just don't recommend bottles or pacifiers until breastfeeding is well established, so babies don't take a preference to one or the other.
And going back to like the working mom, one of the things I've noticed with breastfeeding is you want to wait long enough that breastfeeding's well established, but like you said, not too long to the point where they're not going to take it. And I always tell moms, more than likely